Your body talks at night, and your sleep posture is one of the clearest messages it sends. This is part one of my sleep series. Stay tuned after the video for a full series breakdown to get the best sleep of your life. In this video, we're diving into what your sleep position reveals about your body, your nervous system, and even the stress patterns you don't even realize you're holding on to. Your sleep position can be causing spinal tension, which affects your nervous system and could be the reason why your body stays on at night. This is Dr. CeCe. Let's dive in. If you're a back sleeper, you tend to have a nervous system that likes symmetry, openness, and predictability. What it says about your nervous system is your body feels safe enough to stay exposed and open. You often have a balanced parasympathetic rest-digest response. Your joints and muscles aren't guarding or protecting. This is the ideal sleeping position. It's great for spinal alignment, but if your head juts forward, it may indicate tight SCM muscles or weak, deep neck flexors. If your arms always go above your head, it may be a common sign of brachial plexus tension. Side sleeping is the most common sleep position, and it reveals a lot. What it says about your nervous system is that your system is seeking protection. You naturally guard the front of your body. It's slightly more sympathetic activity going on here, that fight or flight readiness. What it says about your body is if you tend to always sleep on your left side, that side is chosen for digestive comfort, GERD, or vagus nerve release. Right side sleeping is often tied to shoulder tightness or a dominant breathing side. Curled knees are tied to a psoas muscle tension, that hip flexor tension. A tucked chin can mean suboccipital tension and airway guarding. If you wake up with shoulder pain, then you may be compressing the glenohumeral joint, the shoulder joint. A numb hand can signal possible brachial plexus compression. And stiff neck could be caused by a pillow height mismatch. If your pillow is too high, you'll feel it on the side of your neck in contact with the pillow. If your pillow is too low, you'll feel it on the opposite side of your neck. The fetal position tells a lot about stress patterns. Nervous system clues are a high protective tone, with the body guarding the organs. This posture is often linked to people who always feel tired or overloaded. In biomechanics terms, the fetal curl shortens the rectus abdominis muscle. It tightens the psoas muscle and it rounds the upper back, reinforcing a daytime flexed posture. People who sleep in this position tend to be people who have low back tension, people who run on sympathetic overdrive, and those that subconsciously guard their abdomen, whether because of stress, bloating, or cramps. Stomach sleeping is probably one of the most revealing positions. Nervous system clues are a body trying to ground itself, often seen in people with high stress or anxiety. In this position, the pressure on the torso provides a calming effect, kind of like a weighted blanket. What stomach sleeping does to the body is it forces the neck to rotate, increasing cervical facet strain. It compresses the low back into extension, and it can trigger tingling and numbness from nerve compression in the neck. Stomach sleeping is comforting. It takes you back to when you were a baby in the crib, nice and safe. But it is not friendly to the spine or nervous system long term. The Starfish Position. This is a wide open, I'm not afraid of anything type of posture. Nervous system clues are a strong parasympathetic dominance. They love to rest. The body feels safe, totally unguarded, and uncompressed. This position is often seen in naturally flexible people or those with open thoracic mobility. However, it can strain the shoulder capsules if the arms are overhead for too long, and the low back may sag without proper mattress support. Constant position changers. If you toss and turn all night, your nervous system is communicating loud and clear. This usually means your body is trying to find a position that relieves tension. There may be possible diaphragm tightness. You may have a hyperactive sympathetic system, or it could just be a poor mattress forcing you to make constant micro adjustments. But the most common meaning is your brain can't fully drop into deep, stable, parasympathetic recovery. Your nervous system is constantly asking one question: am I safe? If your spine is under tension, especially your neck, jaw, or pelvis, your brain gets a steady stream of sensory input that says, stay alert. Posture isn't just about standing up straight. It's about how much effort your nervous system is using to hold you up. If you're feeling exhausted, but your body just won't relax at night, that's not just anxiety. That's spinal tension keeping your nervous system alert. Some common sleep-disrupting patterns are a forward head posture, which causes cervical tension, rounded shoulders, which leads to shallow breathing, and anterior pelvic tilt, which can cause low back guarding. These patterns keep muscles slightly on, even in bed. Clenching your jaw, grinding your teeth, that's not just dental, it's neurological. The jaw and upper back have high sensory input. They strongly influence brainstem tone and are closely tied to the vagus nerve. If your jaw just can't relax, your nervous system doesn't fully downshift, even in your sleep. People assume lying down equals relaxation. But if your posture is tense all day, your bed just reveals what's already there. Your body isn't used to letting go, so the nervous system stays mildly guarded even at rest. Here are some quick pre-bedtime posture resets so that you can get a good night's sleep. First, neck decompression reset. It's about 1 minute. Lie on your back with a small towel under your neck, not your head, and slowly nasal breathe. This signals safety to the upper cervical spine. Next is jaw unclenching cue. It's about 30 seconds. Your tongue lightly on the roof of your mouth, lips closed, teeth apart, and slowly exhale. This reduces brainstem alertness. Next, a pelvic drop reset for about 1 minute. Knees bent, flat feet on the floor or on the bed. Gentle posterior pelvic tilt. Exhale as the low back softens. This reduces lumbar guarding. At night, your sleep position either reinforces tension or releases it. If your posture stays tense, your nervous system stays alert. Sleep isn't just mental, it's mechanical and neurological. When the spine feels supported, the brain can then finally let go. So, what do you do with all this information? Here's the good news. Your sleep position is not your destiny. It's just a window into your nervous system and biomechanics. Here are some quick wins. Back sleepers, support your neck curve by avoiding flat pillows that push your head forward. Side sleepers, support your neck, knees, and pelvis by using a pillow between your knees and under your head to adjust head height. Fetal sleepers, Open that rib cage before bed with some simple extension stretches. You can also do this over a foam roller. Stomach sleepers? Try to avoid stomach sleeping if possible, because it stresses the neck and back. But if you can't, try to transition to 3/4 side sleep by using a pillow under your hip and torso. This is comfortable and it stops you from laying fully on your stomach. Restless sleepers, try vagus nerve work and light breath work before bed. I like the 4-7-8 breathing technique. Here you inhale for a count of 4, hold it for a count of 7, and exhale for a count of 8. You can do this for about 2 to 5 minutes before sleep. Thanks for watching, and be sure to check out the rest of the sleep series. Videos drop weekly. If you learned something new about your body today, hit the like button and subscribe to the channel for more posture perfect videos. And drop a comment. Which type of sleeper are you? This is Dr. CeCe. See you next video.